Simplified explanation. Dialysis-related amyloidosis happens in people with end-stage renal disease, ESRD, who have been on long-term dialysis. The problem protein is beta-2 microglobulin, a normal part of MHC class I molecules. In healthy people, the kidneys filter it out. But in ESRD, beta-2 microglobulin builds up in the blood because the kidneys can't remove it properly. Over time, it forms amyloid deposits, especially in joints, bones, and tendons. Common symptoms and complications: carpal tunnel syndrome, joint pain, bone cysts, spinal stenosis. This type of amyloidosis mainly affects the musculoskeletal system, not the kidneys or heart like other types. USMLE Question 1. A 65-year-old man with a 10-year history of hemodialysis presents with wrist pain and hand numbness. Imaging shows amyloid deposits in the carpal tunnel. Which protein is most likely responsible? A. Serum amyloid A, B. Transthyretin, C. Immunoglobulin light chain, D. beta-2 microglobulin, E. Amyloid beta. Correct answer, D. B2 microglob. Explanation: beta-2 microglobulin accumulates in ESRD patients on dialysis, leading to amyloid buildup in joints and tendons. Why not the others? A. Serum amyloid A is linked to chronic inflammation, AA amyloidosis. B. Transthyretin is seen in hereditary or senile cardiac amyloidosis. C. Light chains are seen in AL amyloidosis from plasma cell disorders. E. Amyloid beta is seen in Alzheimer's disease. USMLE Question 2. Which of the following best describes dialysis-related amyloidosis? It affects the kidneys primarily and causes nephrotic syndrome. B. It results from deposition of misfolded serum amyloid. C. It is caused by deposition of beta-2 microglobulin in bones and joints. D. It only occurs in patients with hereditary TTR mutations. E. It is reversed with vitamin D and calcium supplementation. Correct answer, C. It is caused by deposition of beta-2 microglobulin in bones and joints. B2 microglobulin builds up in patients on long-term dialysis and forms amyloid deposits that affect joints and bones. Why not the others? A. This type doesn't primarily affect the kidneys. B. Serum amyloid A is part of A amyloidosis, not dialysis-related. D. Hereditary TTR mutations cause a different form. E. Vitamin D and calcium do not reverse this condition.